I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I develop many procedures for facial rejuvenation and other treatment. I have this international education program, and today I'm going to talk about CO2 laser, FIRE-XEL, and HIFU Ulche. I made this presentation in Manila. Bison is the enterprise that helped this in the development of the technology. Here we have in Manila, in Makati Diamond Center, and in this occasion I held a conference about my 30 years of experience in the use of carbon dioxide laser and innovative procedures such as facial rejuvenation without skin scar. This is the kind of procedures that I perform from the malar area to the frontal area. I never resect skin. I reposition the tail of the eyebrow through 3 minimal incisions that I developed many years ago, and I have a personal technique about periorbital rejuvenation without resecting skin. In 1998, I present 4 years of experience in blepharoplasty using carbon dioxide laser, nearly 30 years. In 2017, I present my experience in blepharoplasty without skin resection in the SAP magazine, and I have the recognition of the most prestigious plastic surgeon, president of the International Society, said, "Congratulations for the excellent contribution to international plastic surgery." I began in 1994 with a dermatologist from Harvard University, like Hugh Grevelin. You know that the dermatologists were the pioneers in the use of carbon dioxide laser, and the School of Fitzpatrick in Harvard was the first one. This guy is an engineer, in laser engineer, and also dermatologist, and I worked with him in 1994. Hugh Grevelin, Harvard University, Fitzpatrick, and also I worked with Dan Callaway in the Mayo Clinic. I researched a lot in carbon dioxide laser, and I helped improve this machine. I'm working with engineer Thomas Lee. Is the CEO, is the owner of Bison, and I give him my experience in order they can improve the laser technology. The FIRE-XEL have different handpiece, different microns, and I use in different way for lower facial aging, like this patient. And here you can see in this way I use 100 microns. Here we can see how I remove the membrana basae, and this is the superficial collagenogenesis. This machine produces bridges of no damaged tissue like this, and this is the membrana basea. For this reason, the patient 7 days after the procedure have no redness, and how you can see. This is my personal technique. This is a stab incision in the upper eyelid, no scar, transconjunctival, and rejuvenation of the periorbital area with laser. But we have more difficult patients like this. If I have the crazy idea to give this face nearly approximation of the wellness, the beautiness that have this patient. For this reason, I developed new parameters from the FIRE-XEL, not only in order to contract the lower eyelid, to contract the malar skin, to contract all the periorbital skin, but also the contraction of the orbicularis muscle, because in the aging process also the orbicularis muscle have a flaccidity, elongation, and have ptosis. Then my idea was not only contract and rejuvenate all this area, but also rejuvenate the orbicularis muscle. For this reason, we developed, you can see here, the deepness of the FIRE-XEL laser, how produce the contraction of the skin. You can see how the skin contracts immediately. Here you can see the holes. The holes are so precise. The bridge is so precise. You can see in this study how the laser produces a hole here, but no transmission of the heat in the surrounding tissues. No damaged skin. The bridge, perfect bridge of healthy tissue, the hole, how the tissue contract, the superficial collagenesis, the stimulation of the collagen, this density tissue is called neocollagenogenesis, and how deep the laser get. Here is deep collagenogenesis near the muscles. This is the patient 4 days after the procedure, a full face laser and full face facial rejuvenation. You can see how is the patient 7 days after. This is because the precision of the FIRE-XEL laser that produce perfect hole with undamaged bridges of tissue that let the skin recuperate epidermis in 7 days. And this is the patient pre, and this is the patient post, and the beautiness is nearly this patient. No skin resection, appropriate use of FIRE-XEL carbon dioxide laser. Here you can see an oval, vertical oval is the elderness, and here is the youthness and beautiness, like this. I rejuvenate the full face. You can see the contraction of the skin. The lower lid cheek junction is here. You can see with the contraction is here. How improve the perioral wrinkles, very difficult, and the beautiness of the patient. All kind of flaccidity of the skin of the periorbital area can be tightened and rejuvenated with this carbon dioxide laser FIRE-XEL with unique characteristic. But also we develop a new HIFU that is called Ulche. Here is with different hand pieces, and this is the hand pieces, and I'm in Manila. I'm giving a lecture of a HIFU ultrasound, microfocalized ultrasound, and this is the patient that the Philippine patient gave me to treat in this moment. You can see the fat here. And here is the treatment. This is a not painful procedure, ambulatory, this is the preoperative patient. Also have different asymmetries. Now we are not going to talk about the asymmetry. And this is the patient 3 hours after the procedure. You can see how improve the sulcus, how I improve this elevation, how I make definition of the mandibular branch. Here is an perfect oval, and this is not an oval. This is a square, and this is an oval. Also I use fillers, but this is not the moment to show. And you can see no definition of the malar branch. And here you can see the adiposity in the neck. And here you can see the definition of the mandibular area and how I can improve all the neck. Here you can see mandibular branch. Here you can see almost neck. Here is retro chin, and here is almost like if I put a chin prosthesis. You can see the projection and the definition of this face. 3 hours, completely different patient. Ambulatory, painless, and this is in August. Also we fly from Manila to Davao, Philippines. In Force Medical Group, they give me this patient with certain similarities I have with the patient, the neck, and this is immediately after the procedure. You can see how I flatten this, how improve the neck, and you can see the mandibular branch, how improve. You can see the definition of the neck and how almost the chin, the beauty of the chin improve. 2 hours after the procedure. The oval, the square. Oval is beauty, square is not so. You can see how improve all this, and also how improve the cheek. This is with the people in Davao. I call this Ultrasound. This machine is unique HIFU. You can make a painless facial rejuvenation. If you use well, you have no side effect, but take a time for the training with the machine. For this reason, we fly all around the world to training medical doctors in different countries. Next year we are going to fly to Europe, Latin America, and also Asia. This procedure is quickly. The patient can continue the same day with the activity, the daily activity. You are going to get always natural effect. If you use well, but if you use bad, you can accelerate the aging process. You can accelerate the aging process if you use inadequately the technology. The effects are durables. The effect of the treatment in the tissue have the best result in 7 months after the procedure. 7 months. They continue stimulation the collagen, tightening the skin and rejuvenating the skin during 6 months. I can say if you use adequately with one treatment, you can get a full facial rejuvenation, sometimes comparable to facelift, and also sometimes comparable with a liposuction. But in liposuction you must do a facelift, you can get under general anesthesia, have a lot of downtime, you can have side effect. With this is a non-invasive facial and neck lipomodulation. This is other patient. You can see the mountain here, the valley here. If I make fillers here, I'm going to take the patient like this. Then, instead of putting fillers, I need to allow to go down the mountain to the valley. Go the mountain, this elevation, to the valley, to the depression. I must smell this and tightening this. And this is the patient 1 month after the procedure. This patient have no filler at all. Just is ultrasound. You can see also how the modulation of the neck. This is 3 sessions. This is almost 3 sessions. And this you can see in young patients, you can see how you can modulate the mandibular branch and improve the neck. Also look always, if you like, you put some filler in the chin, but it's not. The modulation of this is enough to improve also the chin. One treatment immediately after, ultrasound and fillers. And also with this machine I can treat severe acne rosacea. Is a procedure that I perform. With this I help a lot of people that have no solution during many years. I changed the life of many patients. I'm sure I can see you in some country. Like I said, Hoogstra Medical International Education. With Bison, we are going to give lecture and training all around the world. Have a nice day.